Well, hello and welcome to another Two Wise Birds. I'm Sue Boynton, independent dento-legal consultant.
And I'm Dr. Jane Lelean, a business coach and trainer.
And for the first time, and I'm really excited about this, you can probably tell, we've got a third wise bird joining us. We're joined by Pat Langley. Pat, tell us who you are and what do you do?
So Jane, thank you so much for inviting me to do this, and actually thank you so much for considering I'm anywhere close to as wise as both of you are. So who am I? What do I do? I'm Pat Langley. I'm a dentist, and I've been working in the field of compliance, although it didn't used to be called that. It used to be called clinical governance for since dinosaurs roamed the earth. And so my company Apoline is designed entirely to help and support dental practices with all matters relating to regulatory compliance. So that could be CQC, GDC, whatever is required. So that's who I am.
Wow, do you know, that is going to be so challenging just now, because even if I think about last night, wasn't there a new SOP came out from England last night?
Yeah, there was, and I was trying to speed read it last night, shovel a bit of food down my throat, and then get on to quite a big video call, helping and supporting colleagues on that as well. And I guess because I've done this so many times and for so many years, I can kind of scan read it and then say, oh, this has changed, that's changed, this is a good idea, that's not a good idea. And actually, I think, as you know, Sue, we wrote some very, very robust SOPs back before there were any SOPs at all. So sort of April last year, with the intention of helping practices find solutions that are as robust as they possibly can be. Because I think one of the biggest issues is practices don't always find it very easy to translate what an official document says into what they should actually do. And so we are now on version 18.0 of our SOPs with a few decimal points along the way as well. And we aim to keep them completely up to date all the time. But I think the important thing about them is that it says, this is what you should do in this situation, this is what you should do in this situation, and this is what you should do in this situation. And I think the other major issue is that practices don't know what they don't know always, and so our aim is to try and help them with what we know, because that's really what we do.
Wow, that's really helpful. And we were talking with Jane as well before we pressed the record button about there being some practices who really need more guidance than others. And Jane's got a good example of that as well, with people just being directed to a generic SOP. Do you want to talk about that, Jane?
Yeah, no, so I've come across some clients, some dentists that are being asked to see patients face to face. And when they're being asked about the SOPs, can we see the SOPs before we say, yes, we're up for it? They're just being directed to, well, just look at what the CDO's written. Now, actually, we know that that's not good enough. The CDO stuff is just the basic framework. And out of these conversations that I've been having, what has been really interesting is discovering what people think is training. So in the CDO documents, they talk about training and an awareness. And I think that this is fantastic because it completely separates them. So a dentist is given awareness when they're maybe given a document or saying, well, something's changed. But training is something completely different. And evidence-based training is active. And so if we're having training in, let's say for sake of argument, either donning or doffing or wiping the floors, we've had a long conversation about wiping the floors, that's not a cognitive thing. We've actually got to do it. get our broom out, our mop out, and actually wash it, because that's how we integrate the learning. Same with the donning and doffing. We've got to actually do it. And part of it is actually knowing so that we can make sure that somebody else has done it properly.
I think that's right. And the other thing that I'm coming across with some practices when they're slipping into bother is compliance fatigue. And I don't know if you see that, where people know what to do, and then they've got so much cognitive load coming in from so many different places, they're just forgetting some of the basics sometimes. And I'm thinking of social distancing, I'm thinking of mask wearing in the practice, that type of thing. Have you come across that, Pat?
A lot, Sue, a lot. I think it's a massive, massive issue. And it's kind of understandable. And I think actually right here, right now, with the vaccine being rolled out, it is even more important that we don't allow compliance. I would actually move on and call it now compliance complacency, slips in. Lots and lots, I've come across lots of that. And I can honestly say that, so I've helped a lot of practices that have then had issues in the practice with COVID outbreaks, and they've always been traceable back to a breach in the protocol. So somebody not wearing their mask, subsequently testing positive, infecting other members of the team. To my knowledge, none of it has been traced back to dental treatment being done. It's all been traced back to breaches in the protocols, compliance fatigue, which is I think Boris calls it pandemic fatigue. And, it is understandable. It is just so important, though, that we don't let our guard down, because if we let your guard down, Mr. Virus is going to be in there, and particularly in these current times where we've got these more transmissible variants around, it's never been more important to stick with it. Social distancing, and then also being aware of the danger areas, lunch times, donning and doffing. I know of one practice where the dentist and the nurse doffed together without, so took their masks off, but I guess too long. One of them was positive, the other one ended up being infected. So I think break times are very difficult to manage. In our practice, we've got a tiny staff room, and it's difficult to manage, and think creatively, perhaps, would it perhaps be advisable for some people to think about eating lunch in their car? I know of some practices doing that. It's kind of thinking out of the box on all of these things to try and make sure everybody stays as safe as possible.
I think it's helpful to hear from you, Pat, when you're helping all these practices, and we know what sort of slip-ups other people are having, and we know what challenges people are having as well. And I think you've given some really good tips for people there. Thank you.
My absolute pleasure, Sue. Absolute pleasure.
So we're going to leave that with you for the video today. At the end of the video, we're going to put some links on, some helpful links for resources that we can direct you to as well, and how to contact Pat to get some advice from her and her team as well. And Jane's got some new things that she wants to share with us too. So we have been the three wise birds today. I'm Sue Boynton and
Jane Lelean.
Pat Langley.
And thanks, goodbye.
Thank you. Thanks so much. Bye.